a reel that I did about sealants, several people asked about probiotics. You know, if the whole goal is to make sure that we're populating teeth with beneficial bacteria, what are those beneficial bacteria and how do we get those? Is there a probiotic that works? And just for background, there used to be a probiotic that I used in my practice years and years ago that worked really, really well. And anytime patients started on this probiotic, their gums looked better, their teeth looked better, they had less plaque buildup, better breath, their teeth would even whiten a little bit. It was great. And then they changed their formulation and I stopped seeing the same benefits in patients that were using it. So I quit carrying that probiotic and have not used one since. So I am, especially just from these comments alone, clearly it's an area where we really want that extra oomph. You know, if our diet's not perfect, which a lot of us don't have a perfect diet, especially our kiddos, then we want to maybe supplement with some probiotics that would be beneficial. So in the current research, the studies that I'm seeing, it looks like there are quite a few strains that are really beneficial. These have been out for a while, on the market for a while. And I jotted them all down, so forgive me for looking away. But the most common beneficial bacterial strains that we have in our mouth are several strep bacteria and several lactobacillus bacteria. So Lactobacillus reuteri, Lactobacillus salivarius, Streptococcus salivarius, and there's two of those. There's K12 and M18, so those are two really good ones. Lactobacillus paracasei, and let's see, another one. Lactobacillus rhamnosus is a really good one, and Strep thermophilus is another good one for cavity prevention and just overall good oral health. Those are the ones that are found to be most prevalent in healthy mouths. So when we're looking for an oral probiotic, those are the strains that we're wanting to look for. There are a few brands out there now. I have not done good clinical studies on how effective, meaning in my practice, I haven't done good research to see, pros, cons, before and after with these specific brands, but I will be testing them because of your questions. So thank you for that. And we will see which ones seem to be the most effective. So there are a few brands out on the market that have multiple of these strains of beneficial bacteria. Orasana is one of them. Replenish the Good is the brand of another probiotic. Super Teeth. And then there's a brand new one from Bristle, the same company that does the saliva test. And so the Bristle probiotic is, I think, the newest on the market and is one that I've just ordered to test out to see how that does. I'll test it on my own mouth then with team members here, and then we'll start rolling it out to patients too, because we absolutely want to help out diet when we can, help out oral hygiene when we can. If there's a way that we can help populate the mouth with beneficial bacteria, then we absolutely want to do that.